Good morning. I'm Jessica Lovell, and we are live from the Dulcie Simons Jr. Family Broadcast Studio at our Olathe campus. Welcome to the Morning Medical Update World Cup Health coverage. Here at the University of Kansas Health System, we are so proud to be the official medical services provider for the Kansas City World Cup 2026 host city. Whether you're a fan at FanFest or cheering inside the stadium or maybe celebrating at your favorite watch party, you don't want the day to end up inside our emergency department. So today we are talking with the experts who are prepared for it all. On our panel this morning, Dr. Brian Beaver is back. He is an emergency medicine specialist. He is also the host city health and medical lead. Dr. Chris Brown is a hospital medicine specialist and chief of staff for the Kansas City division. Dr. Dana Hawkinson is medical director of infection prevention and control. And we have Dr. Stephen Thornton, who is a toxicologist and the medical director of the Poison Control Center. He is also an emergency medicine specialist. And we're so glad to have Chelsea Smith with us. She is the executive director of the Community Blood Center. Dr. Beaver, I want to start with you this morning. Tell us about what needs are we responding to inside the stadium right now?
Yeah, we've done a little bit of everything, which has been pretty typical for our events that we've covered out at the stadium for years. So everything from mostly, thankfully, minor illness, minor injuries, handing out Tylenol, Band-Aids, those sorts of things. But we have had some, including even heart issues and some stroke symptoms that we've taken care of and gotten off to the hospitals so that they could get the care that they needed.
We don't have hard data to share from the World Cup, but we do know that past experiences with other large events have helped. And so far, we've cared for, you said, about 400 people. You've been staying pretty busy. How does the experience with those larger events help in terms of providing pathways for care, especially when they're urgent?
Absolutely. It's been a huge asset to us to have the years of data that we have and have been able to keep detailed data over the years as far as the event, what the temperature was at the time the event started, what the attendance was, how many patients we saw, how many were heat related, how many were alcohol related, etc. And so we're able to take all of that data and then use some modeling tools that exist in mass gathering medicine to help us know about the number of patients we're going to see, about the number of transports we might expect, and then be prepared for the kind of illness and injury that we're going to ultimately end up taking care of each game.
And Dr. Beaver, you mentioned about 400 people. You know, you said you've been pretty busy, but can you put that number into perspective of maybe what you have been expecting?
Yeah, so around 200 a game, you know, which is kind of what we've seen. That's pretty typical for our events in the summer for us so far. So, you know, it was right about where our projections would have put us, and we've been very happy that the vast majority of those fans, almost all of them, in fact, only less than 1% have had to be transported, and we've been able to care for all the others right there on site.
Okay, so in an effort to keep things steady for you, let's talk about the benefits of hydrating. How important is it to hydrate early, as they say?
Extremely important. You know, if you wait until you get out in the heat and start getting thirsty, you're really already behind on how much water and electrolytes you need to be getting in. So really important to start early, especially for those that are going to be going out to the stadium. Remember, once you get there, there are some lines that you're likely going to have to stand in potentially for a significant period of time to get in through security. And the bottle of water that FIFA allows to bring in, remember, FIFA requires that to be a factory sealed bottle of water. So you won't be able to drink that bottle of water in line. So really important that you're hydrating before you get there. Hydrate before you get out in the heat at FanFest. You will be able to enjoy the event much better that way.
Well, if a fan has a medical emergency, though, at a match or at FanFest, what should they expect from the moment that they call for help until they actually get medical care?
Yeah, so we have local EMS is on site to assist us in caring for patients. So if they need help getting to a first aid station, EMS will assist them there. Once to a first aid station, we have multiple at FanFest staffed there, as well as throughout the stadium, staffed by the University of Kansas Health System. We'll get evaluated. Hopefully it's something minor that can just be taken care of. If it's significant enough, we do have multiple emergency medicine physicians inside the stadium, and as well as in an external first aid station there at the stadium. And so if needed, we've got an emergency medicine physician right there on site that can take care of you. Hopefully we can take care of it. We get you back to enjoying the event. Worst case scenario, if it's something that really needs to go to the hospital, we'll partner with EMS. We'll get you set up, transported to an ambulance, and off to the appropriate hospital if needed.
Dr. Beaver, great information this morning. We know you need to scooch out of here for your next meeting, so thanks for checking in with us.
Sure thing. Have a good one.
You too. Hey, Dr. Hawkinson, you are up next. So let's talk infectious diseases and what protocols are in place to detect or contain a virus if there were to be an outbreak.
Yeah, well, I would say we understand that all these processes and systems have been put in place for a decade or more now. It is to identify, isolate, and inform people about what's going on. So identify a patient if they come in with certain symptoms or with travel screening that is positive. Identify what those symptoms are, how that patient is doing clinically, and then inform the patient, the family, and of course our employees and every around the health system, so that we can then put those plans, those processes, those systems into effect. We also work closely with KDHE, but also our local partners around the city as well, if something like that were to come up.
Wastewater testing is being done twice a week by the state of Kansas. What are they testing for?
Yeah, they're testing for a number of different things, viruses such as influenza, COVID, measles as well. They're also testing for bacteria such as MRSA and other food pathogens. They're also testing for a certain fungus, but that is more related to just informing places, especially healthcare facilities, long-term care facilities, about the presence of those organisms in the community. There are also tests for things like hepatitis A and other foodborne pathogens such as norovirus. So unfortunately, the data tends to be a little bit behind. So far, the most recent data that is posted is from June 11th. Really, we haven't seen any uptick or detections of those concerning viruses or pathogens in our wastewater in this community at this point in time.
Hawk, the water is being tested for bacteria and for yeast. What are the big concerns with both of those?
Yeah, like I said, depending on what bacteria it is, it could signal an outbreak within the community. For the yeast itself, it is just a specific fungus or yeast that can be associated with infections, especially in healthcare settings. The problem is that it is very resistant to a lot of the drugs that we have to treat. So it's really more for just informing and epidemiological information rather than actually informing the public or a risk to the public.
Dr. Hawkinson, as always, thanks for the update. We know you need to get going, so thanks for being with us this morning.
Thank you.
And we know you may have questions, and you can submit those on YouTube or Facebook using the chat feature below. We'll ask your questions live during the program. And if you're a member of the media, please tell us your organization and your name so that we can identify you properly. Dr. Stephen Thornton, we know many people are going to be celebrating, and that might mean there could be some alcohol involved. What are the warning signs that somebody may truly be experiencing alcohol poisoning?
Well, that's kind of a loaded term, alcohol poisoning, because the reality is there is no dose of alcohol that is safe or non-toxic. And I tell people that there is nothing that the human experience does that is made better by alcohol. I may sound like a little bit of a teetotaler here, but any amount of alcohol is going to make you worse at whatever you're going to do, whether it's walking, driving, anything like that. So I think when you talk about alcohol poisoning, though, you're talking about people getting to those extremes where they have obvious impairment, trouble walking, making very poor decisions. And the problem is that's going to vary between person and person, right? And so it's really hard to say, well, this amount or this amount will cause it. In general, though, if you're drinking more than one drink an hour, you're going to probably run into some issues, particularly if you're out in the heat, because alcohol is going to compound any dehydration. If you're in situations where you need to be coordinated, going up and down very steep stairs at the stadium, for example, you're going to be behind the proverbial 8 ball, so to speak, if you're drinking alcohol in that situation. So and the real trick with alcohol is that we know that the worst person to judge somebody's intoxication is an intoxicated person. And that's really the trick with alcohol, is that As you drink more, you lose that perspective, and you I'm fine, and you drink more, and you drink more, and that's where you can really get into the severe cases where people drink to the point where they do have an accident, or they pass out, or they have some of these other complications of kind of more extreme alcohol intake.
You explained that well. You don't sound like a teetotaler. You sound like a father, straight out of Father's Day, explaining not making good choices with alcohol.
Exactly. There is this old idea, this old thought that there was a healthy or a dose of alcohol. We know that's not true anymore, and I understand that alcohol is part of sports and part of celebration, and of all things, alcohol is probably the most where you want to say moderation is the key. That is the key. The less is more. Enjoy it responsibly, but understand that even that one drink makes you a worse driver, makes you worse at everything. And so you want to be really, really careful when it comes to particularly that and operating any motor vehicle.
That's such great words of wisdom, Dr. Thornton. But what do you do if someone is experiencing these more extreme symptoms?
So you want to obviously remove them from a situation where they can hurt themselves. Get them to the urgent care or to the emergency department. And unfortunately, when it comes to alcohol, even though we've had this long experience with alcohol, we have no way to speed up people getting sober. Your body just has to clear it. So it just takes time. Time and supportive care is all there is. The minute somebody creates an antidote to alcohol, they will be billionaires, but we have not seen that yet. So it is really just supportive care and time. And making sure that they don't hurt themselves or anybody else in that situation where they may not be making the best choices, or they're not coordinated, whatnot.
So let's say somebody's had too much to drink, whatever that may mean for someone. Then they add in something like, an energy drink, one of these like high octane energy drinks. How does that exacerbate the issue?
So we know that that combination, and you add also high sugar type drinks, that combination increases the amount of alcohol consumed. So it kind of gets things rolling even more. And people who drink those types of kind of more sweet, more energy infused drinks are likely to drink more of them, and so get more alcohol and end up that much more poison, so to speak.
All right, so layering the problem.
Exactly.
So stay clear of those. What about other things that may be out there, like marijuana, other substances? Do you have Narcan available?
So we the naloxone, Narcan will be available at all the facilities. And you're right. We have folks coming from countries where marijuana is not legal, and now they come here and it's inaccessible. And and I think it can surprise people how potent some of our marijuana products can be, and people can get fairly symptomatic from just very, very low exposures. So in general, again, the less drugs you do, the better you generally will be, and you want to be careful of any particular substances, because even though it may be bought over the counter at a gas station, that does not mean it's safe. That does not mean it's been tested. It's buyer beware very, very much, and you don't want to become that case study of one who gets into something that turns out to be, quite poisonous.
Dr. Thornton, great conversation today. Very important, World Cup and beyond. So thank you for this. You stick around because I'm sure we're going to have some questions for you, okay?
All right.
And with all of this in mind, let's just take a quick look at those temperatures. We have seen what's known as pretty regular Midwest summer heat, got some humidity and some rain. Today we're expecting a high of 77 degrees, 25 degrees Celsius, with decreasing cloud coverage as the day goes on. So it can heat up pretty quick. Dr. Brown, with so many people traveling long distances to get here, how could something like jet lag or just the lack of sleep they may be getting right now because they're so excited, how could that increase the risk for dehydration and even lead to alcohol poisoning?
Yeah, I mean, anytime, you have a lack of sleep, your circadian rhythm can be kind of out of whack per se, just speaking layman's terms. And sleep is really important in driving and making sure certain hormones that kind of help regulate your fluid balance, your fluid balance and water state. And so when you think about lack of sleep, you disrupt that circadian rhythm, you disrupt hormones that typically will help keep you, the medical term is eubulemic, but basically appropriately hydrated. Then you add alcohol, kind of like what Dr. Thornton was alluding to, which is a diuretic. and promote additional fluid loss, it just kind of compounds on each other, and basically kind of predisposes you to alcohol poisoning and or other side effects of what alcohol can do to you.
The health system has been checking in daily with other hospitals across the metro. What are you seeing with other hospital capacities at various locations?
For us, no matter whether it's the KC campus or our downtown campus or Lathrop Liberty, we typically function at capacity anyway. Just looking at our numbers this morning, for example, we're about 98 to 99%. That gives us about a number of around 845 patients that we're actually physically taking care of. Olathe, when I looked at the numbers this morning around 6 o'clock, we were over 230 patients that we were physically taking care of. So that basically means our inpatient, meaning the hospital itself, as well as the ED, are full. It's Monday. Typically, those numbers increase throughout the week. So I expect as the week gets as the week continues to progress, we're just going to get busier and busier.
And Dr. Brown, what trends are you noticing in the why people are being admitted? Do you know?
Yeah, I mean, it's summertime, so obviously we're starting to see a lot more of those heat-related or exposure-related illnesses that are presenting. When you think about some of the heat-related exposure illnesses or symptoms, it's nausea, headaches, dehydration, lightheadedness, etc., that are being treated, whether it be in the urgent care setting or locations or the emergency departments. But that only compounds the typical things that we normally see, our emergencies, our strokes, our heart attacks, our chest pain, heart failures, and other other chronic or just major conditions that we typically see and treat day in and day out, both within the ED, urgent care, and in the hospital.
Dr. Brown, thanks for your update this morning. I'm sure we're going to have questions for you as well, if you don't mind sticking around a few moments.
Yes, ma'am.
All right, Chelsea Smith. Hey, good to see you.
Good to see you. Thanks for having me.
So it's summer. People are busy, as we know, and there's this, slightly large event called the World Cup happening here in our area. So with that, there is a drop in blood donation. How low are we, and what's concerning you most right now?
So right now we're sitting around a 3-day supply overall. We like to have a 7-day supply. That's what's considered healthy and stable here in our community. I think what we're most concerned with right now is that supply of O-neg, which is the universal blood type. It's what everyone can receive in an emergency setting. We're down to about a 2-day supply of that right now, which is especially concerning because hospitals use a lot of it. So we need to have a lot of those donations coming in the door. Overall, the past week or so, we've seen about a 25% drop in donations since World Cup activity began. Of course, we can't directly correlate that drop to the World Cup, but we can pinpoint where that drop is happening, and it's right here in Kansas City. What we are a little bit concerned with, though, is that we're at the beginning of the tournament, so we've got weeks and weeks of folks visiting our city, and what we don't want people to assume is that they need to avoid Kansas City because of traffic or crowds or closed roads. That's not what we're seeing at all. We're not having any access issues into our donor centers. We invite people to come down to Kansas City, experience the World Cup community, go purchase things at small businesses. Small businesses are reporting that their business is down as well. So it's not just us here at the Blood Center that aren't seeing folks coming through the door. It's kind of community-wide, and we're hoping people can reverse that trend for us and come in over the next few weeks.
Yeah, I'm glad you mentioned that. There's a clear path straight to your door, so not to worry. Take this big event, the World Cup, out of it, but why are summer months typically tough to get donors in the door?
Yeah, summer is historically challenging. I think one thing that's important to note about the blood industry is that we can't collect a lot of blood and then save it later for a rainy day or for a hot day in summer. We know we're always going to have collections challenges, but blood is perishable, so we have to have folks coming in the door or we're not going to have blood on the shelf. In the summertime, schedules change. Schools are out, families are traveling, and then this year, of course, we're hosting the world for the World Cup. But right now is also what's considered in the healthcare community trauma season. So we see between the Memorial Day holiday and Labor Day holiday an uptick in traumatic traumatic injuries that could lead to increased transfusion needs for our hospitals. So at a time when we typically see donations drop, we're usually seeing hospital usage go up. And that's what we're seeing right now as well. That 25% drop in donations, that doesn't mean that hospitals need 25% fewer blood products. It is just creating a larger and larger gap, and we need donors to come in and fill that gap.
So on that note, there's an incentive to give blood right now over the next couple of weeks. Tell us about it.
Yeah, so it's actually not now. It's later in the week, starting on June 26th and running through July 7th. Everyone who comes to donate during what we call this July 4th critical time period will receive a free t-shirt as a token of our appreciation to them. The 4th of July holiday is typically really challenging for us. We see a significant drop in donations during normal years. And then we know we've got increased World Cup activity here to contend with this summer. So we're a little concerned that donations are already dropping this low heading into the holiday, and are hopeful that folks will come on out, get a cool shirt on us, and help us maintain the blood supply during this 4th of July holiday.
And Chelsea, just remind everyone, how many lives does just one donation save?
Yeah, just one donation can save up to 3 lives. When we take it, we can split it into its parts. Those parts go and treat different patients experiencing different issues. And all of that will have taken you just 1 hour, just 1 hour of your time. Come into our door, we'll send you home with snacks, and you will have saved the lives of up to 3 patients in our community.
Hey, you gotta love snacks, free snacks. Chelsea, thank you so much. Great information this morning.
Thanks for having me.
Well, we have some questions from the community today. Just a comment here. 0 alcohol beer tastes just like the real stuff, but I do indulge in a glass or 3 of an organic red occasionally. So, all right. So just moderation, as you say.
Right.
Okay.
Always.
Jeremy says, when you're eating the food at a sports event that might be saltier, a little fatter than you typically eat, especially for those who came in internationally, they might not be used to what we serve here. Will their alcohol tolerance that they're used to at home be different, perhaps, in the stadium?
Well, consumption of food changes how quickly you absorb alcohol, so there can be a tendency to drink more because people, I have a drink, I don't feel that buzz, I'm going to have another drink. So you do have to be careful in that regard. But the content of the food itself shouldn't change the tolerance of the person. That's kind of a downstream type issue. But again, moderation being the key, and if you really, trying to stick to that less than 1 drink an hour will usually keep most people in a zone where they're not going to have the problems that we've kind of talked about.
Yeah, the food indulgent might cause some other issues, but not necessarily.
Right, yeah, that's for the GI doctor.
That's a whole other show, for sure.
Exactly.
Okay, Jill has a question. If you think you have alcohol poisoning, will throwing up help? And how does a hospital treat alcohol poisoning?
So in general, throwing up is actually part of your body's defense against alcohol. So you will see people will vomit when they become very, very intoxicated. However, most alcohol gets absorbed fairly quickly, within 30 minutes to an hour. So most of the time, it's not going to be enough to prevent sort of the problem's already there, let's put it that way. And as far as treatment, as I was alluding to, really it's supportive care, meaning we give medications to help with the vomiting. We make sure that they're breathing and their airway is okay. But ultimately, to get the alcohol out of your body, it's really just time, and the body will clear it, and people will sober up. So there's that period of time where you can have issues where people can become so basically unconscious that they have trouble breathing, and that's in particular where being in the emergency room can save somebody's life. But for the most part, it's just time.
Time and regret getting over.
Yeah, well, the next day, yes, exactly.
For sure. Dr. Brown, Connie has a question for you. Do those hydration powders, those little packets that you can buy at the store, do those actually help?
Yeah, I would say yes. I mean, when you think about some of the oral hydration powder solutions, especially in the appropriate clinical context, when you're thinking about, alcohol and, heat exposure, you're out in the elements and you're losing fluid and electrolytes, it can be useful to kind of help replenish that rehydration and I would say prevent dehydration.
All right, Teresa has a question. People probably aren't carrying around their pickle juice bottle, but for maybe after this event, a good tip, does pickle juice actually help hydrate you?
I would probably say no. You know, pickle juice has a lot of salt, but it really does not have the what I would describe as the other electrolytes, the glucose, the carbohydrates that really physiologically, and I don't want to get too nerdy right now, but just want to kind of keep it simple, that really truly allow for the reabsorption of water, which keeps you hydrated. You know, interestingly enough, I have heard certain people say that it may help with cramps. But I think, you know, in the setting, especially with the conversation we're having today regarding heat exposure, alcohol, and all of the things from a dehydration perspective, when you're starting to have cramps and things of that nature, that's your body already telling you that, you know, you are dehydrated or getting close to being dehydrated. So you're really going to want to replace, the yourself with fluids, whether it be with water, plus or minus the oral hydration powder, electrolyte drinks. And or if it really persists to get bad, I mean, that's when you need to kind of present to the urgent care locations and or emergency rooms for maybe a high level of care like IV fluids to kind of help with that dehydration and complications that can occur with heat exposure related issues and or alcohol related issues.
Dr. Brown, you never have to hold back your nerdiness with us. You know that. That's why we have you on. We love it. We're here for it. Okay, question from Charlie, wondering if his high blood pressure medication could affect how he reacts to the heat. Dr. Thornton.
I would say in general, yes. Depending on what type of blood pressure medicine it is, you have some that cause you to lose more fluid than normal. You have some that can actually sort of reduce your body's warning signs when you're maybe getting dehydrated. So just like with any medication, you do want to be careful with that and any sort of extremes, whether it's heat or cold. So yeah, that would be just something to keep in mind when you're preparing for going to a game, making sure again that hydrate early, hydrate a lot. In general, you can't go wrong with hydration. So whether you're taking blood pressure medication or not, you want to stay well hydrated.
Last question, Dr. Brown, is from Alice, wondering if drinking those non-alcoholic beers is better as far as dehydration goes.
Well, I think the big difference, you have to kind of look at beer, which has alcohol, versus the non-alcoholic beer. When you think about beer, alcohol within itself, again, is a diuretic, which promotes water loss, fluid loss. When it comes to the non-alcoholic version of beer, it primarily consists of just water, some carbs, maybe some electrolytes, but it does not equate to, again, that electrolyte powder or solution that we briefly discussed already that does promote and has the necessary electrolyte balances, sodium, glucose, carbs, etc., that is going to promote the physiologic process where your body will absorb water to maintain hydration or to at least assist with rehydration and or mitigate dehydration. So to answer your question, is not worse than beer, but at the end of the day, it's not going to replace electrolyte powder solutions, powders, etc., and appropriate fluid.
Dr. Brown, Dr. Thornton, thank you both so much for being with us today. Great information.
Thank you.
Well, remember, we have you covered at the World Cup, bringing you the very latest health updates in our live shows every Monday, Wednesday, and Friday right here at 8 a.m. Our next show focuses on concussion awareness and keeping athletes of all ages and all abilities safe. We want to say thank you to all of our doctors and our experts for their time and to our viewers for watching. We have also produced some short videos to help you over the next few weeks. You can find these videos on our website and on YouTube. Today's offers advice on large-scale emergency situations. Then stay tuned for an encore edition of the Morning Medical Update. You're going to meet a young mother facing a breast cancer diagnosis, but she didn't let her location stop her from getting the very best care that she needed. See how our teams work together to coordinate treatment and support for patients, no matter where they call home. Thank you again for watching, and we'll see you back here on Wednesday.
No one likes to think about worst-case scenarios. But in a potential major emergency where a large number of people need care, it's vital to be prepared. I'm Andy Marshall, an emergency management specialist. I have important information for what to do in a large emergency situation, how to stay safe, and then what to do to help after the event is over. Your immediate priority is your personal safety. If you are in a crowd and something happens, move away from danger. Keep moving until you found a safe location, preferably one with first responders or first aid. Help others if you can. Simple actions like steering people to exits can save lives. Communication is vital in major emergencies. Follow directions from first responders and law enforcement. Stay informed and avoid spreading rumors and misinformation. Do not overwhelm networks by making unnecessary calls or repetitively calling 911. Once the threat is over, move further from the scene or seek first responders for further direction. Treat people that are injured if a first responder is unavailable. If someone is significantly bleeding, apply direct pressure to the wound to reduce blood loss. In case of a burn, remove any jewelry, watches, and clothes to prevent skin from being further damaged. Rinse with cool, not freezing cold water to clean the wound. Cover affected areas with a dry, clean sheet or loose bandages. Continue to seek immediate medical care. By following these simple steps, you can be part of the solution when it matters most.
Good morning, I'm Jessica Lovell. Today, we bring you an encore presentation of one of our very favorite programs. Our team is working hard behind the scenes to bring you more amazing stories when our live programming returns in September. If there is an urgent update from the health system, of course, we will be here to let you know first. Until then, please enjoy this encore presentation and make it a great day.
I don't think my outcomes would have been the same.
Coming up today, a young mom diagnosed with breast cancer makes a life-changing decision. Her health is worth the drive. We'll show you how we coordinate care and tailor treatments. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. It started with a routine checkup, and then Ashley heard the words no one wants to hear. You have cancer. Ashley lives in rural Kansas and was faced with a daunting choice. Where would she go for her care? She chose the University of Kansas Cancer Center, and this morning she is sharing her journey, which includes road trips, tailored treatments, and even a few TikToks.
Higher?
These are the moments Ashley Hurd worried she'd miss.
Oh my goodness, buddy.
A hot day on the playground with her 4 kids and her best friend and her daughter.
Go, Scar, go!
We caught up with all of them after Ashley's doctor's appointment.
She has cancer. Bummer. But she doesn't have cancer anymore.
Ashley has 11-year-old twin daughters. There's also 4-year-old Coco.
It's like cancer.
Coco can be blunt.
She would whisper to people when I would have my wig on and we'd be in church or something. She'd be like, my mom really doesn't have any hair.
So, 4 charming kids and a loving husband. It looked picture perfect until that routine mammogram revealed breast cancer.
Definitely a tough pill to swallow.
Ashley considered her options. She eventually chose the University of Kansas Cancer Center for her care, even though it's more than 5 hours away.
It is a long drive, but my health is worth it.
It's been a long road. Ashley's TikTok videos tell the story. A young mom wanting help for anxiety and depression, discovering cancer.
I was recently diagnosed with breast cancer, and I start chemo next week.
Going through chemo and surgery. She documents the tough moments. But keep scrolling, Ashley is a fighter. She's working out, and then this. Ashley credits the medicine and the encouragement she got from family and her doctors.
This is what you need. This is our plan. This is what we're going to do.
And not just a firm medical plan, a plan that recognizes the travel burden for Ashley.
It is us as the provider being mindful on when patients are coming and going and maximizing their time here.
Dr. Jamie Wagner is Division Chief of Breast Surgical Oncology at the University of Kansas Cancer Center. As part of Ashley's care team, Dr. Wagner was also mindful that Ashley needed chemotherapy before surgery.
The tailored therapies, though, goes to another level where we currently practice of not just getting the right medicine, it's even getting the right order of treatment.
I don't think my outcomes would have been the same. Slow motion. Mentally, and getting there, cancer's hard and your life changes.
A reality for now, and down the long and windy road back home to Garden City.
We're so glad to have Ashley joining us virtually from Garden City this morning. Ashley, how are you?
I'm good.
Good to have you. Thank you so much for being here and sharing your story. Here with us in studio is breast surgical oncologist Dr. Jamie Wagner. She is the Division Chief of Breast Surgical Oncology. And also joining us is Dr. Eric Lai. He's a board-certified plastic and reconstructive surgeon. Good to have you.
Great to have you.
Great to have you. Good to see you. Well, this is your first time with us, so we're just glad to have you on the show with us and joining the conversation and sharing more about Ashley's journey. Ashley, you work in a school as a speech therapist. Tell us about your job and dealing with cancer at the same time. That can never be easy.
Yes, I work in a school district. I work with special education students on their language and articulation. And yeah, it took a toll on me last year. They didn't get the same energetic Miss Ashley that they're used to. But we got through it.
I bet. Okay, so then how do you balance that with being a full-time mom? We saw a little bit in the video, but it's hard to be a full-time mom and work anyway. But then you add cancer to the story. What was that like for you?
Oh, it was tricky navigating everybody's schedules and making sure that we're all getting where we need to go and that I can still have my same work performance. I'm thankful that I have a good support system around me that is understanding.
What kind of conversations were you having with your children at the time?
My own kids, I was very upfront with them on how I was doing, and there are going to be days where I am tired and I need the help from them, and they really stepped up and were able to help out around the house and be there for me too.
I bet. Helping out mom, I'm sure they love doing that. So I have to ask you, Ashley, what care options were there where you live in Garden City? Did you consider utilizing those?
I did. So we don't have the surgical staff here in Garden City, so I initially was in Wichita for my care. And really, I was just having to coordinate a lot of it by myself. It felt more disconnected. So I was happy to come to KU when everything was all planned out for me and everybody talked to each other. It made my life a lot easier.
Dr. Wagner, how do we coordinate care for patients who live nearly 6 hours away and sometimes further?
Yeah, we actually have a lot of opportunities on how we've now set up our breast program as an entire programmatic treatment team. First and foremost, I think one thing that really was a benefit that I'm excited that we've developed over the last 7 years is our multidisciplinary clinics, and we've expanded those so patients like Ashley that are driving such a distance can see all of their providers from getting their imaging reviewed, any additional imaging that might be needed for us to help make that plan for their treatment. And then they see the breast surgical oncologist, medical oncologist, and the radiation oncologist in sequence all in one day. Although we recognize it can be a long emotional day, but it will cut down so much. And it also allows us to real time make modifications as we are getting additional information from either the imaging or even from the patient during that visit.
What kind of challenges and barriers are there for people facing a cancer diagnosis but also living far away who need, the top of the line cancer treatment?
Right. The one thing that we do not want is that barrier of travel, the distance, to inhibit patients from getting the very best care that they can give, because we understand that when patients are treated in NCI designated cancer center, 40% of the time for breast cancer patients, they'll have a change in their diagnosis and ultimately their outcome. And so we have definite opportunities. Our social workers are amazing at the cancer center, from just reaching out, seeing what the patient's needs are. Is it emotional support? Very importantly, the financial toxicity. We think about not just the gas that it takes to get here and the transportation, but also it is more time off work than somebody that lives in the metropolitan area that can still work a half a day and come see us, right? Like it's at least a day, sometimes 2 days, depending on that distance. So how can we help with gas cards? Even lodging, when patients might need to be here for 1-2 days for treatment, sometimes even longer.
And just alleviating that burden so that they can then get down to taking care of themselves, which makes them a better patient for you to care for.
That's right.
So, Dr. Lai, you see patients when it's time to rebuild, and for women, this is a physical, this is a mental aspect of their journey. Explain the process for reconstruction. Kind of when does that start, and those conversations with Dr. Wagner and the patient?
Yeah, like you were saying, breast reconstruction is really about, restoration of both the physical and the emotional. Mm-hmm. And so we meet with patients early to plan around their cancer treatment. Options can involve like using implants or their own tissue, but the goal is to make them feel like, whole again and not just simply healed. And so we want to restore both their form as well as their confidence.
And what are those emotions? I would imagine it's such an emotional time. You're having to talk about something that's going to be happening after some of these major treatment options come along, the reconstruction part, but you're having to have that conversation up front. So what are those conversations like when those emotions are running high with a patient and you're trying to make some big decisions for down the line?
I think a lot of it involves really listening to the patient. What are their goals? What are their desires? What are their ultimate aims for their reconstruction at the end of the day? And then together in terms of like talking, and coordinating with breast surgical oncology as well as medical oncology, coming together with a plan that, that meets their goals as well as what is, possible and reasonable.
Ashley, how are you feeling following your surgery?
I'm feeling really good. Dr. Lai took good care of me.
How important has your family support and friend support been throughout this process? And just talk about that for those who might be going through this and finding that community support during all of this.
Yes, they have been so supportive. I'm very fortunate that I have family in the Kansas City area, so I've been staying with them for the duration of my treatment. So just like they were talking about, I would come up the night before and have chemo all day and then drive home the day of with my husband. So that support's been huge, as well as my parents and my friends back at home that have been taking care of our kids while we've been gone so I can get my care.
How has your mental health been? Again, it's never easy to talk about, and you've been open about that, which we appreciate, but where can people begin, and where do they kind of prioritize that as they're going through this?
My mental health has been so important, and I am lucky that my primary care has referred to a wonderful therapy system, and therapy has been essential in my time in recovery as well as during treatment, of giving me strategies on how to handle all these emotions, because it's a lot to handle. Same for my family. My kiddos are also receiving some talk therapy too, so it's been helpful for all of us.
Well, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. Ashley, you have been open about your journey. You posted TikTok videos. Explain why this was so important for you to do.
So that started kind of as just my own video diary type thing. I've shared posts on my other social media pages for my family and friends just to keep updated, but this is more of just an inside look of what was going on in my head during this whole process. And it helped with sidestepping some questions with people in the public, because they could watch them and see what I was really going through, and I didn't have to always talk about it all the time.
Yeah, I bet you get a lot of questions. What was the response though from the public? What were some of the questions you were getting?
I think a big part of it is I have a big support system of other cancer survivors, and how they have told me that I felt this way too, and I wish this would have been there for me back when I was going through treatment. So it's really connected me with other survivors, as well as just given a deeper look into what I'm going through with people that may not really know what it's like.
you know, it was an emotional video when you showed you shaving your head, but then it seems like you were somewhat embracing your hair loss journey. Tell us a little bit about that, because so many people have to face that part of this, and it's never fun when we hear it. But what advice do you have for people?
Oh, just take it day by day and try not to focus on the mirror too much. I still struggle with that. I would give anything for those blonde locks back. But it takes time, and it is what it is. Like, just part of the process.
Dr. Wagner, I want to talk about the personalized medicine and the treatments for each patient. Could you explain the importance of specialized treatments and the team approach, and how that really, you know, helps the outcome for the patient?
Absolutely. This, I would say, is one of the most incredible advancements that we have made for breast cancer in the last decade. Is, as I describe it to patients, I'm sure Ash will remember this, is, you know, we understand that actually breast cancer is like a family with a lot of personality types. Mm-hmm. And so the first critical aspect is identifying what is that personality type that the patient has been diagnosed with. From there, we actually have tailored therapies. But the tailored therapies has gone even beyond that, such that even getting things in the right order between local therapy and the systemic therapy, so the medicine side, what's going through your system, that has to be paired together, even in the right order. And based on how we put all of that together, we can now see a difference in outcomes for patients.
Dr. Lai, how do you and Dr. Wagner work together? Because again, I think there's some thought that when, you know, kind of old school ways where, you know, you have this team of doctors, it's like an assembly line for a patient. You know, they see Dr. Wagner, then she goes away, and then here comes Dr. Lai, he comes in and does the reconstruction. But actually, you guys are talking about this up front and how this is all gonna go down when you finally get to Dr. Lai. So how do those conversations
You know, we talk early
happen?
And we talk often. You know, in many cases, like, you know, we can start our reconstruction at the time of mastectomy, and oftentimes that means putting in a tissue expander, which is like a temporary device that we gradually fill to shape the breast. Sometimes we can go even directly to implant in one stage, or we can even use a patient's own tissue. But even if chemotherapy or radiation is needed, it's not necessarily a deal stopper, but we can still start safely. And as always, the key is the coordination with oncology and surgery, just to find the right plan for each patient. We can do almost always something, even if treatment is ongoing.
How has reconstruction advanced over the years? Just being able to present different options to patients. You know, it's not just, again, one size fits all, one option, pick A or B. It's we have different routes we can take.
Yeah, certainly. I mean, there was a time where like there was a lot of it was just really implant based. And now we've evolved to, like, you know, using the patient's own tissue, which initially started off as involving using and moving a lot of the patient's muscle as well as their soft tissue. And now we've evolved the procedure to a process where we spare the muscle as much as possible. And now we're using we're just moving their own vascularized skin and soft tissue. And even in some cases, we can at least attempt to reconstruct even some of their sensation as well by doing nerve grafting.
Dr. Wagner, Ashley told us that she questions if she would have had the same outcome if she had gone elsewhere, because there were times that she wanted to quit, and you, shocker, encouraged her to really keep going. Yeah. Is this just kind of part of the care that's provided by you and your teams, especially the emotional aspect of it?
Yeah. I guess for me, yes, and I would equally say the entire team that I am very privileged to work with has that same mentality. But, you know, taking care of cancer patients, it's not easy, and there's a lot of emotion even on our side that goes into that. I just know that I'm serving a higher purpose, and that's why I show up every day. And that is also understanding psychosocially, emotionally, where our patients are, and helping them through that part of the journey. At least it is for me. That's why the very first visit, it's not just explaining what their treatment options can be surgically, also as a multidisciplinary team. Mm-hmm. It's for me to really understand the patient. And I want to help them along this journey and meet them where they are, but help them get to that finish line.
Yeah, Dr. Lai, it's a job for you, of course, but you're also dealing with somebody in a really tough time for them. So how do you handle that personal approach with somebody? Just
No, I recognize that reconstruction is not just simply a one-day event. It's an ongoing partnership, and so we follow patients long term, for their healing, for their comfort, for their results. We have adjustments, scar care, refinements that we do over time, and the relationship doesn't end just because the surgery is over. I mean, we stay with our patients for the long road ahead.
Could you do reconstruction and mastectomy at the same time? I think that's what people often wonder. Are those two separate surgeries?
They don't necessarily have to be. I would say, like in specific circumstances, we can go like straight to an implant, and sometimes we can even complete your reconstruction in one go. But even if we have other issues going on, we have an advanced stage breast cancer, we need chemotherapy, we need radiation. Like we said, we can start with an expander and get the process beginning at the time of your mastectomy.
Let's get to some questions from our viewers this morning. All right, Jeremy wants to know for Ashley. Ashley, this question's for you. I imagine there's no way to truly know what it feels like to get diagnosed like that unless you're experiencing it firsthand. What was the most helpful thing you heard or that someone else did that was actually helpful for you?
Family and friends-wise, instead of just asking me if I needed anything, just jumping in and volunteering to pick up my kids or bring a meal by, that aspect was super helpful. And not just saying, I don't know what you're going through, but to just be there for me, because it's different for everyone.
Lynn wants to know, can aerobic exercise help prevent the recurrence of breast cancer or strengthen our immune system so that it can recognize breast cancer cells and protect us from being affected by the disease?
I don't know that I would necessarily aerobic specific exercise, but in general, the one thing that we want all patients is to maintain a good body weight, because we know that obesity is associated with higher risk of cancer and recurrence. I would say actually the greatest newest literature, it's really the combination of muscle strengthening, which we had a phenomenal video I think of Ashley doing that, with that cardiovascular activity and pairing that weekly. Because the other aspect is, especially when it affects men, but the dominant population with breast cancer are women. And we know that weight-bearing exercises also help strengthen our bones, which can sometimes be impacted by the treatments that are given.
This question is from Becca. When do you decide between a lumpectomy and a mastectomy? Isn't it always better to get rid of any chance of it coming back?
I love this question, so thank you, Becca, for asking, because that is the natural, when I first see patients, it's get it off so I never have this happen again. The reality, however, is after several decades of research, lumpectomy, when combined with radiation, is completely equal in survival, risk of recurrence to a mastectomy. So me taking off the breast, doing bigger surgery, doesn't make a better outcome for patients. The key is that we get around it with a clean rim of tissue, or what we call a negative margin. And sometimes we can't do that without doing the mastectomy. There's other nuances that we also have to think about, and that comes up in the consultation: genetic mutations, patient other comorbidities that might be taken into consideration on their ability to be able to get radiation or conversely undergo mastectomy. It's very personalized, but just remember, bigger surgeries, not better.
Good question. Okay, Linda has a question. Do people with depressive tendencies or those who are taking antidepressant medications have a higher risk of developing breast cancer?
Great question. To date, we do not have any solid evidence that shows that patients with a history of depression have statistically higher rates of breast cancer.
All right. Question is, how is immunotherapy different from chemotherapy?
Great questions this morning. And I'm sure my medical oncology colleagues are going to love me being a side medical oncologist this morning. No, but immunotherapy are going to be medications that actually elicit the immune system to be able to fight the cancer. We are fortunate that we have developed a couple of different specifically for those tailored therapies. Currently within breast cancer treatment, it is coupled with a cytotoxic chemotherapy medication. Because original studies have just shown that when coupled, patients will have better outcomes. And in that specifically, what we have looked at historically is pathologic complete response, which means when they get chemotherapy before surgery, then I take them to surgery and cut that out. On the final pathology, the pathologist has been able to tell us what percentage of cells are still alive. Well, we want to see 0. And it's that coupling, and that's, again, how that tailored therapy all comes together so specifically for patients is important.
All right, there's no more questions from the community, but I have a question.
Yeah.
I'm so glad you're on this morning because I had an encounter last night that I need to get your advice on. I had dinner with a friend of mine. She's 53 years old, has never had a mammogram. And so I asked her, I said, well, when was your last mammogram? And she said, I've never had one. So I did kind of go into my what, kind of thing, and she said, I will have one when I want to have one. And I thought, kind of tick-tock, when's that going to happen, Yeah. And so I was a little concerned, and she kind of got annoyed at me, I got a little defensive. She was a little defensive, and I said, I'm probably going to harp on you about this a little bit, and you'll probably be irritated with me, and I'm kind of okay with that. But how do you have conversations with people where you're not, they have their own reasons, and her reason was that she's afraid, she doesn't want to find out. Which then I went into my Jamie Wagner spiel of, well, it's better to find it early because there's lots of different options, and you can, there's, better outcomes when you catch it early, and so on and so forth. And so, yes, it was kind of an awkward conversation. And I was surprised because I really don't come in contact with a lot of women who haven't had their mammograms. And so, and now, because I do the show, I think I'm somewhat of a, pseudo physician. So I didn't want to be judgy, but how do you have those conversations with women or friends that you come in contact with without shaming them, but really urging them? Because I was very concerned. I genuinely was concerned. Yeah. What is your advice?
Yeah, it's a hard position to be in, but if you really care about people, you'll have hard conversations with them, right? And do your very best to advocate for their health. And sometimes they don't understand and I think have the privilege of having these kinds of conversations that we get to have. You explained it perfectly from the beginning. I was recently at a conference and I heard somebody make a statement that our advances in mammography and our advances with all the technology that are we're diagnosing more breast cancers. True statement, but it was followed on non-meaningful breast cancers that aren't going to threaten survival. So we're currently in an era that we're researching which cancers don't need to have treatment. Like maybe there is that subset and it would not be an invasive cancer by any means. It's the in situ or the non-invasive cancers. But to date, we actually do not have the appropriate long-term data to even say that. The other aspect is we can't tell without doing a mammogram and diagnose the breast cancer if it's a meaningful breast cancer or not. I don't have the crystal ball to say that you are going to have a very aggressive triple negative or like Ashley HER2 positive breast cancer versus a patient who has a very almost dormant type of in situ disease. But the reality that we know is why do mammograms improve survival? Because we diagnose them early. Very early stage, stage 1, stage 2 breast cancers. The earlier that we find the breast cancer, the better the outcomes. Studies have just shown that time and time again. But in current era, the earlier that we do that, we have also been able to de-escalate a lot of our treatments in those much earlier stage breast cancers. So we don't have to give as much chemotherapy. Sometimes we don't even have to sample lymph nodes anymore for patients. But if we wait too long, then you're getting the kitchen sink.
All right. Well, I appreciate you having that conversation with me because I was wondering what you would think about that. But it made sense to have you here with me today. But yeah, it's just so important, and you never really know how to have those conversations.
Yeah, they're hard.
They are hard. Ashley, I bet you have more of these conversations now with your friends than ever.
I do. And honestly, I don't even have to have them. They watch my TikToks and have seen my story and just go and make their appointment all by themselves.
Perfect. I love that. I love that. You are doing your part, no doubt. What do you want the big takeaway to be, though, from your story for those watching and being inspired by you?
Well, as far as my Carrot KU, just because it's so far away doesn't mean it's not for you. The team is really willing to work with me and to give me the best outcomes too, even though I'm far away.
Well, thank you so much for sharing your story, and we're so glad you're doing well.
Thank you.
Dr. Lai, what's the big takeaway today?
I think the takeaway is that Ashley's story shows us that world-class care can reach every corner of Kansas. Distance shouldn't limit our outcomes. And when we're able to coordinate together oncology, breast surgery, plastic surgery, that patients thrive. Healing is about body, mind, and community, and we can provide comprehensive care no matter what the zip code is.
Absolutely. Dr. Wagner, what's the big takeaway from this story?
Well, it's always my takeaway, I think. And it couples Ashley's story with your last question is be your own advocate. Second opinions can change lives. We've seen that. This is a perfect example of Ashley's story today, but advocate for one another as well. And if somebody says if your gut is telling you, get it. You're not harming anything by just a second conversation.